Welcome everyone. It is my pleasure and honor to welcome everyone to this webinar on how to deal with stress and anxiety during the COVID-19 pandemic. This coronavirus has impacted all of us in many ways, and our lives have had to deal with the new challenges, and as a result, has brought upon us much stress and anxiety. The outline for this webinar is going to be, I will give my opening remarks, then our subject matter expert, Anne-Marie, will give her presentation, which will last about an hour. After that, there will be a question and answer period, and then there will be a thank you note after that. So before I dwell more on this webinar, let me tell you a bit about OFIC. Overseas Friends of India Canada is a voluntary, not-for-profit organization, a Canadian organization. All of its executives are volunteers, and they do not receive any remuneration. 100% of any funds received are spent on its activities and events it organizes, such as this one. OFIC brings together Indo-Canadians as well as people from other communities of all ages, ethnicities, faiths, and political stripes, following the spirit of multiculturalism. Friendship and our core civilization values are to work towards strengthening the ties between India and Canada and serving the Canadians at large. OFI's mission is to foster friendly and mutually respectful relations between people and citizens of Canada and India, to enrich, project, and promote the positive image of the Republic of India and Canada and vice versa, to host, organize conferences, regional festivals, and webinars such as this one we're holding today. OFIC has done many webinars and events such as a webinar on international students in Canada, fundraising for victims of Fort McMurray in Canada, the fire that they had in Fort McMurray of Alberta. And one of our main events that we do every year is the National Diwali celebration on the Parliament Hill. And this year it will be virtual one, and it will be held on November 12th. So I welcome everyone to attend that event as well. For more information, you can go to our website, www.ofic.ca, or our Facebook, Overseas Friends of India, Canada, Ottawa. The executives of OFIC are made up of myself, President Shiv Bahaskar, Vice President Executive Narinder Garg, Treasurer Kulbhushan Kapoor, Program Director Shefali Adhikari, and Technical Director Puneet Agrawal, and Secretary is Nagmani Sharma. This webinar is being hosted with the help of Avid Solutions, who are providing the project management and IT solutions for this webinar. Canadians of Indian origin have always played a constructive role in the development of the world, as well as serving Canadians at large. Without further ado, let us get on with this webinar. Let me introduce you to our subject matter expert, Anne-Marie Clarkson. She will be giving us a presentation on how to deal with stress and anxiety. She has Bachelor of Arts with a major in psychology, Bachelor and Master's in nursing. Anne-Marie is an advanced practice psychiatric mental health nurse with a background in counseling and psychology. With over 15 years of experience helping others achieve good mental health, Anne-Marie continues to bring her skills and expertise to the forefront during this epidemic. As an advocate for barrier-free mental health for all, Anne-Marie is currently involved in several projects that aim to bring mental health support to the most vulnerable in our society. Now over to you, Anne-Marie. Thank you.
Thank you, Shiv, for that. Okay, so today we're going to talk about specifically mental health related to COVID and the pandemic and how it's been impacting Canadian residents since the starting of the pandemic in March. What we're going to look at today is the overall impact of mental health. We're going to talk a little bit about some specific demographics who are particularly affected and impacted by the pandemic. And hopefully we're going to end with some useful strategies and supports and where you can access help if you find that you are suffering or experiencing some increased difficulties during this time. So again, I'd like to thank the OFIC for making this really important presentation possible, as well as the Canadian Red Cross and the Government of Canada for recognizing and providing funding for really timely and relevant supports around the COVID-19 pandemic and making them accessible to as many Canadians as possible. So today, as I mentioned before, we're going to go over some particular themes and objectives related to COVID. I'd like to have us look at the mental health statistics, both locally and nationally for Canada in general, pre-COVID-19 pandemic. And then we'd like to look at how our mental health has been specifically impacted in relation to the COVID-19 pandemic. We're going to take a little bit of a look and review on the stress response cycle in terms of really understanding what might be going on with us in the last 8 months. We'll talk about recognizing burnout, as some people may be now experiencing as we have advanced towards the 8th month here in the pandemic, soon to be 9th month, how we've been impacted significantly, and some people might recognize that they are suffering now from something called burnout and what we can do about that. We'll go on to talk about and describe the concept of resilience and why resilience is so important in mental health related aspects currently. Some mental health awareness. So how do you know when you really do need more help? How can you recognize that, or how can you recognize that in your family and your loved ones? And we'll end with some mental health supports that you can access now. Not sure where everyone is tuning in from, but when I focus on the local data, we're focusing specifically on Ottawa or Ontario, and we'll see how we can support our local residents with that. So I'd like to do a little activity right now. So if everyone can just take, if you have access to either your phone or a pen and paper, or just tally this in your head, I'd like to do a little temperature check on you in terms of your level of stress and how COVID has been affecting you. Everyone recognizes the temperature gun that we see everywhere around now, but I'm going to take a few minutes to try and gauge your levels. All right, so first I'd like everyone to give themselves 1 point for each of these statements if they are true for you. So give yourself 1 point for each of the following statements. Do you have children under the age of 18? Do you live with elderly family members? Do you have a family member in a long-term care facility or a retirement home currently? Do you or someone you live with are considered high risk in relation to their physical health? So that would be someone who might be immunocompromised. And if you were not born and raised in Canada, you can give yourself another point. So this time, I want you to keep going and keep adding your points, but give yourself 5 points for every true statement in the following list. Do you own a small business? Do you currently live in a rural community? Are you an elementary or high school teacher? Are you pregnant or trying to conceive? And is your 2019 annual household income, was it less than 48,000? So another 5 points for each of these statements if they're true for you. We're going to keep going. Now you're going to give yourself 10 points for each one of the following statements if they are true for you, and you're going to keep adding them to your total. You or someone you live with has tested positive for COVID-19. You lost your job due to the COVID-19 pandemic. You're a frontline healthcare worker, so a nurse, a doctor, a respiratory therapist, a paramedic, or you were another essential worker. Are you a member of a marginalized group? So either a cultural minority, homeless, physical, mental disability, and elderly persons, etc. And you can give yourself another 10 points if you are not a Canadian citizen or permanent resident. So if you want to take a second and just add up all your points, see how you do, what your score is, what your COVID temperature is. We can see here that those who maybe had none of these statements apply to them, got 0 to 5 points. If you're starting to feel a little bit affected and impacted, you probably give yourself somewhere between 6 and 20 points. If you gave yourself 21 to 30 points, you are definitely impacted negatively by the COVID-19 pandemic. And those who gave themselves 30 points or more, for sure, are having some significant impacts related to the COVID-19 pandemic. And all of these pieces added together result in an increase in stress, an increase in anxiety, an increase in potential for mental health concerns, and potential for some serious complications related to mental health. So the mental health of Canadians. I'll just go through some statistics of where we stand right now in Canada and in relation to the rest of the world. How are we doing with our overall mental health? So in any given year, we know that at least 1 in 5 Canadians experience a mental illness or a substance use problem. And of course, these are Canadians who disclosed or recognized this in themselves. I'm sure that the numbers are actually even greater. By the time most Canadians reach 40 years of age, at least 50%, so 1 in 2, will report that they are currently or previously had a mental illness. So they are diagnosed or they are seeking support for a mental illness by the age of 40. And Canadians in the lowest income group are 3 to 4 times more likely than those in the highest income groups to report poor mental health. When looking at Canadians in respect to the general population, there are many studies that are done, particularly with the WHO, or the Global Burden of Disease calculations, and the highest levels of mental health diagnoses, or the most prevalent mental health diagnoses that are found in the world, and this is a 2017 study, would be anxiety disorders and depression and alcohol use and substance use disorders. So those are the most common across the world. They are also the most common that we see in Canada reported. So by far, mental health services are going to target those particular concerns and issues, such as anxiety disorders and depression, as well as substance use disorders. How are we doing by province? So if we look at our prevalence rates for mental illness overall, you can see that in Canada here, you can compare your province on how you're doing nationally. So if you look at this spike here, Nova Scotia, how is the mental health of Nova Scotians? You can see that females are significantly more affected and impacted by mental health than males here, but that if you compare Nova Scotia with, let's say, Northwest Territories or any of the other ones, how are they doing overall? So in Canada, we welcome new Canadians of all kinds. When people move to a new country or a new area, there's obviously some adjustment, and that adjustment can have some mental health consequences. We do know that recent immigrants do report fair or poor mental health more often than any other Canadians. We also know that mental health of more than half of recent immigrant participants has worsened since the implementation of physical distancing related to COVID-19. And recent immigrant participants in studies done by the Government of Canada and StatsCan, they're more likely to report symptoms of anxiety than any other Canadians. So in this infographic in a study done by the Institute for Clinical Evaluative Sciences, they looked at the different needs of mental health care within different ethnic groups in Ontario. So if you're looking at Ontario specifically, you can see that more than half of the people in Ontario's 4 major ethnic groups who self-reported mental health didn't seek help. And this is quite concerning, especially when we go into situations that are drastically impactful, such as the COVID-19 pandemic. So in this graphic here, you can see that our Caucasian population here report poor mental health. And if you look at other comparisons between our South Asian population, our Chinese, and our Black community, we can see that there's a significant amount of people who report mental health problems. But if you look at the lighter shaded area here, and this is where it's really important to take note of this, is that this is the amount of those people reporting poor mental health that did not seek help or support for their mental health disorder or their experience of mental illness. And you can see here that although still about half of identified white individuals reported poor mental health, a good proportion of them sought mental health services in relation to that. When you compare that to our South Asian and Chinese Canadians, the amount of people suffering mental health is far discrepant between the amount who are seeking that support. So when we look at youth, we know specifically that 70% of mental health problems have their onset during childhood and adolescence. So this is a really important concept to keep in mind as we're working through the idea of COVID-19 and how our children and adolescents are affected. Young people aged 15 to 24 are the most likely to experience mental illness or substance use than any other age group in Canada. So mental illness is classified as a disability. It is one of the leading causes of disability in Canada. This is recognized and documented through many studies. And in this particular graphic from Statistics Canada, we can see that there's a lot of emphasis on both the types of mental health supports that are needed, what are some of the barriers, and who is seeking help. If you look specifically at the spread across Canada here, you can see that in terms of for Canadians age 15 and older who identify as having a mental health related disability, the national average is 7.3%, but you can see in certain provinces like the Atlantic provinces, it jumps to 9.9%. In Ontario, we're sitting at 8.1%. In Quebec, it shows 4.6. So we can see in comparison to how we are doing across the national average, as well as in relation to each province or territory. So the territories are at 5.7%. So in Ontario, we have a significant amount of people who relate to having a mental health related disability. That has great impacts on our economy and um, our people who live and reside and work in Canada. So there is help, and it's not all bad. And even people who have severe mental health issues can do very well if they reach out and get support in a timely manner and get the right support when they need it and how they need it. So I'd like to introduce you now to a young lady who was featured as one of the faces of mental health in Canada recently. And we can go ahead and play this clip of Karen Deep sharing her story.
My mental health journey began when I was 15 years old through my first suicide attempt. I went into the hospital and a social worker said to me, "You're lucky to be alive." A psychiatrist said to me, "I'm sorry what you're going through." He explicitly explained to me what schizoaffective disorder was. I think it's so important to educate those around you because they want to care. Like my mom always cared, but she just didn't understand what was going on. So growing up in this community, my mom and a lot of people in my family in the Punjabi community have told me this doesn't happen in India. Like it's just not talked about in my community, and I want to put forth that open discussion. Me and my dad had a very, very close relationship. Some would even say that we were inseparable. His passing, I say in a way, don't be sad that it's over, be happy that it happened. He lived through so many predicaments and obstacles. Like I said, he had 3 strokes, and at one point in his life, he was paralyzed on the left side. And what he taught me was resilience. There is this amazing woman at my high school, and she sat me down one day and she said, "Your story needs to be heard." She kind of encouraged me to share my story to the teaching staff of my school. It was one of the hardest experiences. It was the first speech I've ever given in my entire life. So when I looked into the audience after sharing my story, I could just see tears in teachers' eyes. Just there was so much kindness and understanding. It was just all very unexpected. And I did a speech through the Mental Health Commission of Canada. I had people come up to me say, "Your story has allowed me to want to get help." And when they come to me and say that, it makes me realize why I do what I do. I would say I'm still in the process of understanding recovery. Medication will be part of my life, and that's okay. But that medication is not the only solution to mental illness. You have to change your whole lifestyle around, and you have to participate in positive activities. To be one of the faces for 2020, it's honestly such a surreal experience. I never thought I would come to a point where I'll be able to share my journey through such a broad audience. Without my mental illness, I wouldn't be the person I am today. If someone is just beginning this journey right now, I would say keep going. If my life had ended that day, the self-growth, the self-love, and the people I've met since then, and the memories I've made, that would all been non-existent if my life ended at 15. Today I look at myself and I say I'm happy to be alive, and I say these words in knowing that I have a purpose here, that I'm enough and I'm worthy, and that I look forward to living my life to the biggest potential that I can.
Were undertaken in Canada that really looked at what our mental health is doing, and this was around in the summer. And what it revealed was that 7 out of 10 Ontarians believe that there will be a serious mental health crisis as a result of the pandemic. And this is back in July, and so we hadn't quite, we'd only been a few months into the pandemic, and it's still going on. And this is 70% of Canadians do believe that we are headed for a crisis. there are some already seen negative impacts, and that would be that the stress levels of Ontarians have doubled since the onset of the pandemic. And this is self-report levels of stress in Ontario. They have doubled since the pandemic. 55% of Canadians have reported worsening of their mental health since the pandemic began. And the description of those particular feelings that have worsened are their worry at 44% and their anxiety at 41%. And 81% of Canadian workers reported that the pandemic is negatively impacting their mental health. So those Canadians who are in the workforce are having a significant impact somehow in their mental health. So we can look at how we're doing with COVID-19 in relation to the rest of the world. We can look at specifically by province, but generally speaking, the industrialized countries in North America, in United States and Canada are probably doing the worst. They're reporting the highest numbers of impact of mental health on them since the start of the pandemic in terms of difficulty coping. As well, in Canada, Angus Reid polls have suggested that there's quite a significant portion of those who are not managing well during the COVID-19 pandemic. About only 34% are reporting that they're doing okay, and the rest have some sort of difficulty. Either they are mentally struggling, they're financially struggling, or they've had multiple stressors. This is how Canadians have described their mental health during the pandemic. We can see that many report they're worried and anxious. Some have reported that they're grateful. I'm sure that those are the ones who have reported that their overall health is doing okay. But there are other negative consequences. Depression is high. People are feeling numb. People are feeling overall quite pessimistic as the pandemic goes on. And looking at some of the other impacts of COVID-19 in Canada on mental health is that many feel that they're in crisis, or they're not sure that they have any ability to cope, or what their ability to cope with this going forward is, as well as having a concern generally over their own mental health. And if you look at those numbers together, we're looking at 32% of Canadians are seriously concerned about their level of mental health during the pandemic. So this just demonstrates another example of where the anxiety and where the worry is in terms of mental health experienced by Canadians. So a lot of Canadians are worried about their own health, but they're also worried about generally overloading the healthcare system. They're worried about the health of a family member, even more than their own health, as well as the stress that isolation and confinement of staying in your home or staying in wherever you reside is causing the family. And there's a lot of crisis that is being experienced by having to isolate like that over an extended period of time. As we can see, this has impacts on some negative behaviors as well. We see that a lot of people are spending more time on the internet or watching TV. So screen time has significantly increased. As well, we notice an increase in alcohol consumption, alcohol being the most abused drug that is available within Canada. That's readily available, and we look at ages 15 to 49, 20% have increased their alcohol consumption during this pandemic. In particular, we see that mental health impacts do impact recent immigrants or refugees and new Canadians even more so than Canadians who were born here. We can see that in this graphic here, we can see as per Stats Canada, that women are more affected than men. Well, not in this graphic, but we see that depending on your immigration status, that will depend on how you report your symptoms. And minimal and mild symptoms are quite high in all categories. But if you look at this one here, those reporting severe symptoms, those would be in your recent immigrant population, so 0 to 5 years of immigrating to Canada, you see having the most severe symptoms reported. We also look at the mental health of our Indigenous peoples in Canada, and since the pandemic has begun, 60% have reported that their mental health has worsened since the onset, particularly related to physical distancing measures. And if we know anything about up north in Nunavut and the territories, they are already isolated to begin with. Introducing extra physical distancing measures or imposing restrictions on their movement it can cause even more damage. So what's important to recognize here, though, is that everybody is affected by the pandemic. Everybody's mental health, for the most part, has been impacted in some way negatively. But what's really important to underline is that not everyone is affected equally. There are certain populations in Canada that are way more affected, both personally and physically, around how the mental health pandemic has impacted them. So if we look at the general population being about 6% having suicidal thoughts since the outbreak of COVID-19, we really look at already people with a disability, their increase in suicidal thoughts, they're at 15% since the outbreak of COVID-19. People with low incomes, 14%. People who identify as Indigenous or people who are already struggling with mental health before the pandemic began are far more likely to continue to have suicidal thoughts or worsening of suicidal thoughts since the outbreak. So what's going on here? Well, we've all been under a huge amount of stress since the pandemic has started. Stress is our body's response to anything that makes us feel pressured or threatened. It's a natural response, it's a biological response. It's ingrained in us as human beings. We know that stress can be beneficial in some states. Stress helps us in terms of protecting us from danger. But prolonged chronic stress over time has some pretty serious negative consequences. So when we look at the stress response cycle, we can describe it as being exposed to a difficult event or difficult experience, such as the pandemic. What happens in the initial stages is we get our adrenaline flowing, our cortisol, and everything in our body starts moving us towards reacting to stress. This can have physiological consequences like our head is hurting and our heart is pounding. We get short of breath, we get tense, our muscles tighten. We get pain, we experience this as pain, or we experience it as more severe illness as well. Our pain makes the stress worse, and this increases the psychological stress and the psychological impact, because when we are in pain, we are not able to successfully make decisions that are, in a way, our best interest or supporting ourselves at reducing our stress. And the cycle just keeps continuing. So we understand that stress affects our body and our mind. It affects our emotions as well as it affects our behavior. And this is why it's so important. It's an all-encompassing issue when we talk about mental health. It is not a diagnosable disorder, but it is something that affects all aspects of people's lives. But what happens when your stress becomes too much? We've now, in a good portion of 2020 is over. We have been in the pandemic for quite some time. Our initial stage of fight or flight within our stress response is petered out, and we've moved on to a stage where some of us may no longer feel that our resources that we have to cope are enough. And this is when we experience burnout. So burnout is a state of emotional and mental and physical exhaustion that's caused by excessive and prolonged stress. So the longer we experience stress and anxiety over time can lead to burnout. There's a difference between stress and burnout. And basically when you're looking at burnout, you're looking at things like disengagement. Your emotions are blunted. You no longer are demonstrating emotions. You just sort of blah and numb. You feel helpless. You feel hopeless. There's lack of motivation, lack of hope. You can be detached. You can be at higher risk for depression. It does sometimes make life not worth living. So here are some of the warning signs that you are experiencing or at the verge of experiencing burnout. And these are pretty clear. If you see any of these in yourself, you can pretty much guarantee that you are on the burnout spectrum. A lot of the studies on burnout and stress do focus on work-related stress in regards to burnout, but it is not just in the workplace that we get burnt out. We get burnt out psychologically and emotionally within our families and within ourselves. Although there is most of the research is put towards looking at burnout from a workplace perspective, it is not the only option. So if you feel exhaustion and isolation, if you have escape fantasies, like you just want to run away, you just want to leave what's going on behind, or if you use alternatives to help you escape, so drugs and alcohol or food, anything as a way to numb your emotional pain. This is a lot of where the excess screen time is coming into play. So people are numbing or suppressing their fears and anxieties. This will cause likely a significant increase in irritability, more than just the normal, and for a prolonged a period of time. So it can cause people to have issues within their family. They are less able to tolerate change. They are less flexible. Things that you used to be able to just kind of brush off now cause them significant amount of distress. As well as a physical component to burnout, this results in frequent illnesses, and it can be like more frequent colds or other illnesses because your immune system is suppressed. But and this is even worse during a COVID-19 pandemic, because if you are having symptoms of an illness that may be similar to the symptoms of COVID-19, then this can cause additional stress in that you have to take time off work, you have to isolate further from family and friends or stay out of school. And the negative stigma are associated with people who have been tested or may have symptoms of COVID-19 are certainly going to cause an additional amount of anxiety on people. So what do we do? Can we cope with the negative effects of burnout? Yes. And what we really want to do is, when we're looking at the stress response cycle, we want to be able to complete the cycle. Our body has been under stress and our minds have been under stress for months and months and months. One way that we need to do to help manage some of the stress is we need an outlet for the stress to go to. We can, mentally prepare ourselves to get through stress, but our body needs to catch up as well. We need to physically do something to help us complete the cycle. There's a lot of research that's just coming out about this stress response and completing the cycle. And one of the researchers that I particularly like are Emily and Amelia Nagoski, who wrote a book called Burnout, and they do look at different ways to complete the stress cycle. And this is a really good, easy to read or download through Audible book, because it really helps you see why we can't just deal with our stress mentally. So some of the ways that we complete the stress cycle, the number one absolute best way is physical activity. These are all evidence-based strategies, but by far the most evidence and the most research has proven that physical activity is the number one way to help you move through the stress cycle. And physical activity does not necessarily mean running a marathon or even just running for 5 minutes. There are many people who can't or physically not able to move. Physical activity could be just as simple as going for a walk, could be just stretching exercises. It's something. You have to move your body. And the second one, it says your crew. So this is there's a lot of research that says that your support network is what's really important and what's going to help you through in your stress and coming out the other side as a stable person. So this social contact, this and whether or not it's your family or your friends or anybody, it could even be strangers. The idea of interacting with others in a positive way to form social connection is a proven way to help you reduce that stress and decrease the negative impact of the stress response. Breathing is another one. You'll hear this a lot, and often they do physical activity and breathing together. What we mean by breathing is slow, controlled, mindful breaths that are specifically designed to reduce our heart rate and bring us back to the present. So there are lots of breathing techniques that you can use to do this, but what the idea is that you're taking deep breaths in and holding it for a period of time, a few seconds, and then letting all your breath out slowly and holding that for a period of time. And you're repeating that over and over, maybe 10 times, in order to get that effect on your body of calming it down, reducing your heart rate, reducing your blood pressure. There's lots of apps that you can use on your phone to help you do this. If you've got a Fitbit like me, there's even a remember to breathe section on there, which will go through like about a minute of breathing exercises and encouraging you to take deep, long, slow breaths. Another really important way that we can move through our stress cycle is through laughter. And there are biological reasons for this, but basically we're not talking about like the kind of social superficial laughter. We're talking about really deep, like put it all out there laughter that is not controlled, the belly laughs, doing something really fun and just being with people that make you completely uninhibited and just laughing. Affection, of course, is another one. And by affection, we don't necessarily mean physical affection, although that can be, that is part of it. But affection just in terms of even just being with people that we know have our best interests at heart, that we love, that love us back unconditionally. There are lots of people in Canada, though, who might not have extended family with them, who might not have children in the house. How can they feel affection and how can they get that as well? There are also people who suffer from or experience different conditions that make them less able to share their affection with others or make them uncomfortable to have physical affection, and that's okay. Affection can come from anything. Affection can come from an animal. There's a lot of research that states that pet therapy or animal therapy is extremely effective, particularly on those who may not have the physical or mental and psychological ability to reach out to others in terms of their emotional realm. They can use like petting a dog, as it gives the same amount of hormonal release and positive effect and positive impact as hugging another human being. And the last two, which are also really important, are having a good cry and creative expression. And by crying, we mean letting it all out, like actually letting your body physically go through the whole process of crying. So wherever you feel safe to do that, you can use that as a physical mechanism to remove that stress. Creative expression is another one, and we're not talking about you have to be an artist or a Van Gogh or a singer, anything creative. And the reason why creative expression is important and what it's connected to is it's connected to your emotions. So art and creativity are connected to emotions, and the expression of our emotions helps us to complete the cycle. So how do we make sure that we are able to withstand all of this over time without significantly impacting our mental health in a negative way. One concept in a way that we can do that is resilience. And resilience is the process of adapting well in the face of adversity or trauma or tragedy or threats or any other significant source of stress like what we are experiencing right now in the pandemic. There are lots of definitions of resilience. We're going to show you a short video from Public Health on the meaning of resilience more, because this is a really important concept. But basically, what we're looking at is being able to continue on and advance despite adversity, and not necessarily waiting for adversity to happen and reacting to it, but being proactive and making sure that we are prepared to cope with adversity when we face it. And if it's okay, I'd like to show that video now.
Think of a challenging time in your life. Maybe you had a problem at school or work or with your partner. Maybe you were under a lot of financial stress. Did you find it hard to get through this time? What helped you to move forward? Being able to work through life's challenges in a positive way is called being resilient. Resilience is about being able to cope through challenging times and recover afterwards. It helps us to thrive and reach our full potential, even when times are tough, and it can make the difference between feeling overwhelmed by a challenge and using the experience as something to learn from. Resilience doesn't come from having a perfect life. It doesn't mean we always have to be happy. In fact, it's normal to feel sad or angry during tough situations. Resilience is more about how we move forward through the challenges and deal with them successfully. Sounds like a good thing, right? It is. In fact, research shows that being resilient helps us recover from illness faster, live longer, and do better in our daily activities. It also helps us to have happier, healthier relationships. The good news is that we can all practice skills to be more resilient and help others be resilient too. Being resilient is not just something you are born with or without. It's something we can all work on over time. We can even help teach our family these skills. Improving our resilience skills helps protect us against mental health challenges and illnesses in the future. Let's look at an example. This is Jennifer. Jennifer has been having a hard time lately and is feeling stressed and upset. Her mom isn't well. She has some major bills she didn't expect this month, and her dog Shiloh passed away a couple of weeks ago. So what are some things that Jennifer can do to help her through this hard time? Well, she can think about things that helped her cope in the past. She knows that being active, listening to her favorite music, and spending time with her friends and family helps her feel better. She can also think about good things in her life, like her relationship with her partner. She can think of solutions for some of the things she has control over. Maybe she can work some extra shifts to help with the bills. Jennifer should also know that talking to a healthcare professional is always a good idea when going through difficult times. One of the best parts about resilience is that it is never too early or too late to start practicing. So let's recap some proven ways to build and maintain resilience, like knowing your strengths, thinking of things you are grateful for, being able to find solutions to challenging situations, being okay with not doing everything perfectly, practicing deep breathing and meditation or mindfulness, asking friends, family, or a healthcare professional for help, letting your kids work through challenges and supporting them as they learn how to deal with their struggles, and of course, eating healthy, having healthy hobbies, getting enough sleep, and spending time with your loved ones helps us all. Like Jennifer, we can all benefit from these tips when going through challenges, and we can even pass them on to others when they are going through difficult times. So now, think about the things that helped you with a challenging period in your life. What new things could you do next time that would help? Write these things down so you can go back to the list when you need it. Try one thing this week that you can do to build on and maintain resilience in your life. For more info and resources on resilience, check out havethattalk.ca. Brought to you by Ottawa Public Health, with support from Bell Let's Talk.
All right, so thank you for that. So hopefully you have a good understanding now of what we mean by resilience and how we can be proactive in supporting ourselves to be able to deal with upcoming adversity in a better way that's going to help us manage our mental health. What are all the components then of resilience? As we saw in that short video clip, it gave you some strategies, but really what we want to do is focus on building our resilience for the long term. That is a lot harder. Again, it's one of those easier said than done things. So although we can use the strategies that were mentioned in the clip, what we really want to do is really boost up our ability to be flexible. We want to maintain strong relationships with our community, with our family, and with our friends. We want to be able to build in that spiritual sense that we may have, whether it is with our cultural group or however we express our spirituality. We want to be able to tap into that during this time. We want to use coping strategies that are positive, not negative. We want to avoid things like using alcohol or drugs or food or screen time to numb our distress and find other positive coping strategies to replace them. And this is where we can talk about, and when I get into where to go for support, where your professional counselors can help you develop some of these things that'll work for you. We want to make sure that we ourselves come at problems with a non-judgmental mind. We want to use mindfulness and every day if we can, and at least practice examining both ourselves and our reactions to things that are going on around us. We need to become aware of how our bodies are responding to stress and how they're responding to cues in our environment. And we want to make sure that we build in strategies to promote emotional regulation. And what that itself means is recognizing when we're having an emotional reaction to something that is out of proportion than what we generally would do, like yelling at your children and screaming when you've had a hard day at work after you've come home, and your reaction to your kids leaving something on the floor is disproportionate to what actually happened, which is really not significant. You can move the thing on the floor, but your reaction is overblown. So emotional regulation is another thing that working with a professional will help you get. If you have high self-esteem already, you're already built in and equipped to have resilience. So anything that you can do to help boost your self-esteem or improve it in any way is going to help you along the path to resilience. So how do we know when our mental health is deteriorating and we need more support? So some of those cues are going to be pretty obvious. Stress and how we're dealing with stress, because stress, as we talked about earlier, has a very physiological component and a reaction is apparent. If you're feeling more anxiety than usual, if you're having symptoms of hopelessness, if you're moody and irritable, and your sleeping and eating habits, once those change and you are unable to sleep or you're sleeping too much, you know that there's a serious impact on your mental health. So this graphic is a really good depiction of the continuum of mental health, and this one is is used in the Canadian Forces for educating their personnel. And if you look at the injured or ill section, you can see particularly in the ill section that some of the cues that you need more support than just what we discussed so far are things like excessive anxiety and fatigue and sadness continually, having panic attacks and being angry and having anger outbursts, inability to concentrate, You can't get through your daily routines and your daily activities without significant struggle, sleep disturbances, a sense that you've really lost control over anything and therefore are either overcompensating for it, or you've really withdrawn from taking any control over your situation. Any significant changes in behavior. Usually it'll be a family member or friend who points that out to you first, and they've noticed and observed a significant change in behavior. If you have any indications of suicidal thoughts or intentions, are you thinking about or fantasizing about suicide, or if your symptoms get worse over time instead of better, then we know we've hit the red on the spectrum there. And if we go back to our mental health temperature check that we did at the beginning, those of us who are high on the red zone, so greater than 30 points on that scale, really do need to take this into consideration and consider getting more professional support for ourselves. Again, depression and anxiety are the most common disorders that people will seek mental health support for. How do you know that you're having anxiety? You're experiencing some of these things. There's a physical aspect to it: headaches, rapid heart rate, insomnia, problems with your stomach, this kind of thing, as well as the lack of patience and just being general irritable and procrastinating and trouble concentrating. So if any of these things resonate with you, and they all do at some point, but during the COVID-19 pandemic, it's significantly worse, there's lots of ways you can get help. There's general support, and I can go through some of those and what's involved. But for most people, if your workplace offers an employee assistance program, you can explore that. You can ask your supervisor. You can check out what is already available within your workplace. There could already be free resources that are available to you that are short-term and they're anonymous. Your employer doesn't need to know. And you can check those out, and you can get some sessions or support or resources or be directed to the right place. You can also do some self-directed learning in terms of support. And if you use resources like ementalhealth.ca or the resource that we gave you in the handout from Public Health, those are really good ways of at least starting the process of looking into where you might feel comfortable accessing mental health services. There's also local support groups or community organizations whose specific interest is to develop programs to bring people together. Now, in this society, it's probably virtual, but to bring people together with similar backgrounds and experiences to discuss, talk about, and learn ways to cope with their distress. You should also be seeking out your primary care physician or nurse practitioner. One of the problems we have in Canada and many countries is that there aren't a lot of primary care physicians for everybody, and nurse practitioners. It's not easily accessible, and sometimes you're on wait lists forever or you don't have access to that. You can find resources. Even a walk-in clinic will be able to provide you with the resources that you need if you don't have a primary care physician to access. If none of that suits you, there's online peer support groups that are managed by mental health professionals. This is not just going on to Facebook and going into a random chat about anxiety. You want to make sure that the online peer support group that you're venturing into is moderated by a mental health professional who can provide you with the support and guide you towards resources that are applicable for yourself. And as well, there's one-on-one counseling that's available. In previous years and days and times, this was done in person. Now we have a huge uptake of professionals who are doing this virtually, which is far more convenient for many people. It can be done on off hours. They don't have to travel anywhere to do it. They don't have to leave their children or take off work or find a babysitter. So it is extremely encouraged to seek out that type of support. And I'll talk about where you can get that. So if you're in crisis, it's always good to have resources available at the ready, because when you're in crisis, you are not necessarily able to think clearly and review resources that you've collected. So here are some of the local Ottawa supports that people can access that are available 24/7. Some of them just via text, some of them you can call, some of them have both options available. And this is included in the resource guide that is available through this webinar. Youth specifically might have some hesitancies or challenges in wanting to personally access mental health supports for a variety of reasons, and there are specific supports that are designed for youth when in consideration. And many of these services cover youth up to the ages of like 27 to 30. So when we're talking youth, we're not just talking about like 18 and under, we're not talking about children, we're talking about people who, it's a more broader range, and many of these services are offered anonymously and some by text. So you don't even have to actually speak to someone about your concerns. I think one of the most important things, and one of the things that Ottawa does really well, is provide culturally specific supports to our various cultural groups that we have here. And it's really important, I think, to emphasize and put resources towards local groups who can provide services that are culturally appropriate to the people who access them. It is great that we have such a variety, and there's even more in the handout indicated, but we have specific resources for mental health for our Indigenous population, for our Chinese population, and Somali and Muslim and different immigrant services available. These are by far considered safer spaces for people who are a different cultural or national background to access, and they're available, and I highly encourage people to access them. So one of the things that's really great, and I mentioned at the beginning, is that our government is putting a lot of funding towards supporting people now. People need help now. So one of the things that's available through this program, as well as others, but particularly, I would encourage everybody to visit the site and register for free counseling if you've been impacted at all by COVID-19. You are not alone. The counseling sessions are available and provided by mental health professionals, and it's specific to people who meet the criteria of being impacted by COVID-19 and are not normally covered by other financial resources. So if you need help now, I strongly encourage you to register. There are many sessions available, and you can get it right now. And I'd like to thank everyone for participating in the webinar. We can go to a question and answer period now, and thanks again to the funders for providing this opportunity to Canadians.
Well, Anne-Marie, thank you for very informative and very informative and other information that you have presented there. I certainly found myself to be you know, very much learned from you what you have presented, and it's really helpful. You know, when I used to get stressed, I would go play sports, like, and I found that activity to be perfect. Like when you play sports, like I play basketball or tennis or golf, I forget everything. I don't think about anything else. And when I used to have a tough day at work or a tough day at home with the family, I go play sports, and that was it. Like you totally re-energize yourself. So I cannot stress enough the fact of what you're stating, that you know you have to find a way to let that stress out, to get over that anxiety. And physical activity was always very good. Another thing that I always found much more fun and relaxing was playing music. So if you're creative, you like to write or do any or paint. I know when I used to play drums a long time ago, and it used to be great. I was in my own world, and all my stresses were away. You know, and you talked about resilience, having, you know, self-esteem. Of course, that people who have that, it's easier for them to deal with the stresses and the different challenges that we have. You also talked about some of the symptoms, sleeping too much or not sleeping enough, and a lot of other things. But if you're having a suicide thoughts, I mean, that's when you're in that red spectrum. You're in that danger zone. And so if you are in that danger zone, or even you anywhere close to that, I strongly recommend that you get professional support. You know, especially we're fortunate that Red Cross has provided some funding, and Overseas Friends of India can act as a conduit. We are more than happy to help with that, and we will not be keeping any medical information, anything to do with health. We'll just direct you to the health professional, and they will do all that. So having said that, thank you again. Very informative. A lot of good information. There was a tidbits we can all learn from, even though if we're not stressed or anything. This is definitely well worth your time and effort to listening to your thoughts, to your presentation. So at this point, I'll turn it over to Nashi. Nashi, you're the one who's going to be managing questions. I believe we've received a number of questions from the different attendees. So Nashi, over to you.
Oh, hi, thanks, Shiv. So if anybody on the webinar has any questions, they could use two options there down on questions. You could go there and post your question there, or if you want to remain anonymous in your question, you could also use the chat private system there to send me a message, or send an email. I'm actively monitoring the email as well. It's pmcovid19@ofic.ca. So that said, we have a few questions that we could cover. I'll just pick the common ones, common themes. One of that is, if I seek mental health services, will it impact my job prospects, or could it be used against me?
Yeah, so that's a really good question, and it is really common. So, and unfortunately, it's one of the things that cause people to have reservations about seeking support. So in Canada, we have laws that protect people against being impacted or affected negatively by seeking out their health care, seeking out mental health care. So although your employer may need to know in general what if you need to take time off, or if you have a particular health related disability which includes mental health, they do not get the details nor the extent of what it is that you're going through. It's treated like any other physical health issue, and your privacy is respected. So we are lucky in Canada, and there are rights that protect workers and employees against discrimination for seeking support for mental health issues.
All right, thank you. So another one I have is, what are the reasons why people resist seeking professional help when they're struggling with mental health issues? And there's another question, I think I could club it with it, and that's and basically they're saying, I'm having a hard time dealing with everything, and it shows, and is it okay to talk to young children? So it's like a two-part question there, and the first one is being why people are resistant to seeking mental health help, and the other part is how do I deal with children and how to engage them in this topic.
Let me just add, first of all, to what Anne-Marie had said earlier. As a senior manager with the federal government, I've had managed many employees over the number of years of my career. And, some people had challenges, and let me tell you that none of that information can really be used against you as an employee by the employer. And it's normal that we all have different challenges and we deal with it differently. And any of that, if you do go seek a professional help, it cannot be in any way, shape, used against you. So I'll just add that as a non-professional in the psychological world, but as a professional executive, I could add to that. Go ahead, Anne-Marie. Sorry to interject.
No, that's actually really important, and I myself did work as a senior manager as well, and there is lots of training that can be available to leaders in your community about supporting your employees who may be struggling with mental health. And so some managers may not realize that there are specific things that they can and can't do to support their employees. And I think engaging in that type of training for managers is really important, and it is available out there. But to go back to the second question, which was kind of a two-part question, some of the, some of the factors that really do influence whether a person will come forward and seek help for their mental health concerns. There's a lot, but some of the biggest ones include things like stigma and how mental illness is stigmatized still in today's society and in, in our modernized world, that there is still a huge negative association with people who are identified as mental, as having mental health issues. So whether that's a stigma from your own cultural group, and there are definitely different cultural backgrounds, cultural groups that are less likely to feel comfortable talking about their struggles with mental illness. And that's why I strongly encourage people to seek out supports that are culturally aware for your particular needs, because those people will identify better with you in terms of providing that type of support, as well as talking to kids about this. So I have worked with a lot of families who they themselves, as the adults, are extremely stressed about it, and they're worried about showing that distress to their children, and they have an urge to shelter their children from the exposure to the stress in the community and to the adults in their life. It is really important that you do talk to your kids about this. So recognizing when you are displaying distress or you're going through some of these other symptoms, acknowledging it, explaining to your children in very basic terms why it is that you're maybe not feeling as great as you used to, and then asking them how they feel and really including them in the conversation. I know that educators are doing this with children in schools right now in terms of getting them to really share and express their views. If you don't share, they won't share, and that causes far more distress than it does talking about it. It's encouraged to talk about it, but to talk about it openly and not in a way that will bring fear more to the children. So, more about how they feel emotionally and some of the things that worry them about the pandemic, like not being able to see their friends or going to school. Just really hear what their particular concerns were, because their concerns are likely not the same as the adults in their lives, but getting them to share and talk about it and receive support for it from their own parent is really important. There is also a lot of resources through CHEO and through other children's organizations locally that have resources on how to talk to your kids about COVID.
I think I can add to that. As a parent and as a coach, I used to coach basketball, and I coached very young kids from Adams to Bantam level. And the big thing is the communication. I cannot stress on that enough. Have an open mind. Try to put yourself in their shoes, what they may be going through. Try to look at it from their angle. It's always, as a parent, sometimes you think this is the only way or the right way, but you kind of have to have an open mind. You have to be able to see, see the end from the beginning. You want to be able to see why they might be going through things and what would be the consequences, and how can we really put them at ease, and what's the best way to communicate this, even your methods of communication. I know when I was coaching, the parents came to me and said, look, I'm having this issue with my son or my daughter, and can you help out? And sometimes the kids came to me and said, look, I'm at home, I'm having this issue, what should I do? How should I talk to my parents? Or what, even at school, at the teacher. So Just be there as a listening person and having an open mind, and put them at ease. The more ease you can put them at, the more comfortable they'll feel about talking about this. So both as a parent and as a coach, I cannot stress enough about the communication, and try to see it from their point of view, and try to put yourself in their shoes and what they might be going through. I know a long time ago I was a teenager too, right? So we all got through that stuff.
Like
And
5 years back.
I'm sorry.
No, I'm saying just a few years back.
Yeah, it was very. Anyway, thank you. Go ahead. Next
All
question.
right. The other one I have here is is medication always necessary? Is there any way to avoid them? I'm thinking, there are, like, you have that spectrum over there. And one more reminder to everyone, this entire recording will still be available online. So there's quite a few things that Anne spoke about on how to reduce stress and how to identify which part of the spectrum you are on and what to seek or when to seek help. You could always refer back to it along with the handouts. If you go below here, there's a section called handouts, and there's a couple of documents in there you could download that has a lot of resources on the subject, as well as this recording will be available for you to watch it on YouTube. And we'll people who have attended here, we're going to send you an email with the link, and so you could look it up. That said, there's a question here. I think you sort of talked about it, I think, a little bit. This is about medication. Can we manage without medications? And medication not necessarily is a bad thing. I mean, there might be some situations that would require them, right? But it's good if we can manage without them. I mean, that's my personal opinion, but I'll let you speak on it.
Yeah, for sure. Absolutely. You kind of already hit the nail on the head there. Although the gold standard and the best evidence-based support for mental health issues, mental health disorders, is a combination of psychotherapy as well as pharmacological therapy. That is specific to people who have been diagnosed with a particular mental health disorder. That is not necessarily the majority of the population, nor is it when we talk about 50% of people by the age of 40 are going to experience a mental health issue. It's not necessarily a mental health issue that requires that level of medical intervention. For the most part, for most people, counseling and therapy is by far enough. Right? So just several sessions of some targeted support from a professional is enough to really make a difference. And medication is not needed at all. Medication is used in conjunction with your physician or psychiatrist for people who are having extreme issues or long-term or chronic issues on coping related to a particular diagnosis. And some of that might be genetically derived or other things like that. Though that is more in the medical realm. For the majority of people who suffer some sort of mental illness or struggle, whether it be temporary or chronic, medication is not necessarily effective nor warranted. It's really a personal preference, and that's in discussion between you and your counselor and your doctor.
And the other thing I could like to add to that is there's a lot of natural way of helping, like yoga and different philosophies of the world have different way of coping this, and they work very effectively as well. So I encourage people to even look into alternative. I guess they call it medicine. Yoga would be considered alternative medicine, I guess, in a way. Anyway, back to you, Nashi.
Yeah. So I think we're pretty much close to the closure now. And the last one I have, I think, is one of the things that we all are going to confront at one time or the other, is ourselves hitting the lows or the highs and coming across people. And this question is more from my side. How do you inform people that they might have to seek some kind of professional help without offending them? It could be our relatives, it could be our friends or coworkers. Sometimes we see them, confiding in you, or just you see the signs of stress coming out. How do we tell them, hey, maybe you should, sometimes some people might be offended. I mean, it depends on person to person, right? Is there a way to, this is the last question here, and after that, we're gonna close this once again. So you could just stay tuned for a few minutes before you leave. Go ahead.
Thank you, Nashi. That actually is a really important question. I'm really glad that you brought that up. It's funny, we're so Canadian, right? We have fears of offending people, even our own family members, to point out that they're struggling and maybe they should get some support. It's so interesting because really it should just be everybody gets support as a standard, and then just some people need more. But how do we approach people that we're concerned about and encourage them to? I think that really just stating the behaviors that you are observing as clearly as you can and as empathetically as you can. So that would look like, I'm noticing that you are you're having trouble sleeping, you're complaining a lot about physical illnesses, and you just don't seem engaged in at the same level that you used to be. I'm concerned that you're just not doing as well, and I'd like to support you in some way. Either is there something that I can do, or do you think that at this point maybe I can encourage you or direct you to some professional help? So always with empathy, always with pointing out the observations of what you're seeing, not just, wow, you're really moody lately. Not that anyone would say that, but, or, oof, this person's so hard to live with, I'm out. No matter what we do, you're always coming at it with a perspective of empathy, recognizing that, this has really been hard on us the past few months. Not being able to see our extended family overseas, it's really taken a toll on all of us, but I'm really noticing that you are really particularly affected by it. Is there anything that I can do to help? Or, at this point, do you think we should really talk to somebody about it? Because I really care about your health. And showing that and doing that in that kind of way, I hope that's helpful in the way I said it. People are not going to take offense to that. And in fact, their disengagement and their irritability and their anger or their negative attitude is in itself not a cry for help, but an externalizing way of showing people that they're not doing well. And it is important to act on that. It's a cue.
Very, very important comment. I think there's an old saying as well that says, you can only help yourself if you want help. So you have to be able to say, hey, look, I need help, and you're going to help yourself. So get out there, and if somebody is trying to point you in that way, just have an open ear and be accepting. Or I know sometimes when you're in a stress, it's hard to think straight and do all that. But so you can only help yourself if you want help. So help yourself. That's what I'm saying.
Timing is everything in this. And if the person is not ready at that point, that is okay. Just keep bringing it forward. Keep making that offer. Keep saying, I'm willing to go with you, or I'd like to support you. How can I support you? Just keep it open. And if that still doesn't work, the person who is worried about their family member or loved one or friend can also seek counseling to help them with that, for them to seek it out on behalf of their family or friend, to see, I'm worried about someone, I need some help dealing with it, I want to know how to support them, they're refusing to come, can you give us some suggestions or strategies? And then maybe that person will come along for the ride after. So just because it's not necessarily you that's impacted doesn't mean you can't seek out the counseling as well.
Right. Nancy, any more questions before we wrap
No,
up?
I think we're done. So thank you, Anne-Marie, for the session here. It's very informative. Shiva, I'll let you close it. Thanks.
Yeah, so basically, first of all, thank you very much, Anne-Marie. It was very helpful, very informative, and you gave us some great tidbits to recognize the stress, and some great tidbits how to deal with the stress. and I'm sure people can go to your presentation and learn more from it and use it as a tool to cope with the COVID anxiety or just a regular anxiety and move forward. When we put these when these events together, there's so many volunteers that help that are not on the front of the camera right now that did a lot of work. Our executive vice president, Narinder Garg, did tremendous work. Our treasurer, Kulbhushan Kapoor, was behind all this work. Our secretary, Nagmani Sharma, our program director, Shafali Adhikari, and also president of Avid Solution, Prasanta. Of course, Nashi Ahmed, project manager. I cannot say enough about him. He's been doing everything from A to Z. It wasn't for him, we wouldn't get this thing done. So thank you, Nashi. And person working behind the IT, Puneet Agarwal. Puneet, thank you very much. I know you're not in the front, but you hear us and you see us, and you made this process to be seamless. And I don't think this would have worked without you. We haven't done one of these seminars in this webinar in this kind of fashion, so it was first one. So I think it went very well. We had pretty good attendance. We have many people registered, so they can go to it and listen to this webinar at a later time. We will send them emails or whatever we need, so they can, if for whatever reason they weren't able to come on right now, that they can watch it at a later point. So this is available for many times. Also, our next event is going to be on November the 12th, which is the virtual Diwali celebration, which is the Festival of Lights, going from darkness to light, where is conquer of goodness over evil. And it's going to be on November 12th from 3 to 4. We'll be sending emails on that. And also, we will be doing one more webinar like this in November. Nashi, have we decided, is it still November 21st, or have we decided date yet?
Yeah, that date could move. Just another update is I'm working with Red Cross to see if we can get more time to execute this project. And I should know it by Monday or so. And we will send, and there's going to be another webinar, and it can be either towards the end of November or early December. We'll decide and send it, depending on the extension.
Yeah, just to reiterate that there's free counseling that is available.
Yes.
Will be no cost. It'll be total free of cost to everybody. And all you have to do is write to us at pmcovid19@ofic.ca. Although Red Cross has given us a deadline of November 30th, we're working with them to extend that deadline. So don't worry about the November 30th right now. But if you need help, any kind of help, reach out to us and we'll facilitate it. And just to emphasize that, OFIC will not gather any medical history or information. The only thing we'll be doing is we're referring you to the health professional, and that's it. Health professional will keep all your health information and all that, anything related to that. So
that's the standard process. Yeah.
Go ahead.
No, that's just their standard process applies, and our intake doesn't take it. Sorry to cut you off there. And I still have some questions coming up right now. We're going to close the session at 2:30.
Okay,
sorry?
If you have another question, Anne-Marie, is it okay?
Is that okay, Anne? We have still a couple of questions from people, and the rest of the people who want to drop, can drop, but people can stay for a few more minutes. If it's okay with you, Anne?
Yeah, can you just give me like a 30-second break before going to the questions?
Yes. Yeah, definitely.
I'll be right back.
Yes,
okay, yeah, no problem. So basically, yeah, so just to reiterate that there's a free individual counseling, that is therapy sessions that are available. They're available to anybody. It doesn't matter what faith or origin or national or gender, what you are. is just we're there to help, and this will be, and we will not gather any information or any medical history. We will not keep it because OFIC is not set up for that, and nor do we want to do it. So basically, the only thing we'll be doing is we're providing that information or providing the link to the professional counselor, to professional person, and they will, you will contact them directly and deal with them directly, and they'll send us the billing, and we will take care of the cost. So take advantage of it. Okay, go ahead, Nashi.
Sorry, yeah, so I have a couple of questions come in at the last minute as well. One of them is, I feel bad not letting my grandchildren inside our house. How can I help myself feel better regarding this? So this COVID-19 situation has created these islands, you know, and I think this is a very common scenario across some families, especially elderly people or people who are traveling. So he feels, this person, he or she feels bad of not letting the grandchildren inside and feeling terrible, and how could he or she help feel better about it?
Yeah, yeah, you hear that a lot from grandparents who have to be isolated from their grandchildren and extended family. I think that it is really important to emphasize that we know that this is a temporary situation, and we have to call on our resilience skills, and we have to try and make changes and be flexible on what our family dynamic looks like. So although that individual might feel, you might feel personally negative and affected and sad that you're unable to be with them at this time, they would probably really want to know that you are safe, and you are keeping them safe, and you are keeping everybody safe by not exposing yourself. So anything that you can do to maintain contact, even though it's not in person, you should try to. I know everybody doesn't have access to technology per se, whether it's just over the phone, whether it's sending them cards or pictures, keeping those ties open is really, really important. Finding ways to make that contact and reminding the grandchildren that they are still in your thoughts and they still care about you. Please do not feel guilty about the situation, because as we often do when things are out of our control, but this is not something in an individual's control. So what is in our control is looking for ways that we can change and adapt to our surroundings to support those that we love.
Thank you. So this is the last question here. How can you act when you're having your anger and you start yelling? How to change that immediately? I think this is a situation where, you know, you've built up something and you don't want to do it, but you end up doing it sometimes. And how do we control that?
Yeah. One of the anger is a natural response, just like stress is. It's part of the fight or flight cycle. What is really, really important about anger is having personal awareness. So if you make sure that you take the time to check in with yourself and look at inside what your feelings are. Are you feeling agitated? Are you feeling stressed? Take a minute and to yourself and do some kind of decompression activity, whether it's breathing, step aside before you react. Always take time before you react. If you are going to react with anger towards a situation, the best thing you can do, and you know, is this is not to be stereotypical, but is to take a minute and count to 10, to stop yourself in the situation, to be able to notice and observe in yourself how you are feeling, and then react and respond. So it's these are strategies that a professional can help you with. And I would strongly encourage that people who are feeling really angry or noticing that anger is their go-to reaction to stress really should have some professional support in terms of learning these strategies to practice them. It doesn't come naturally. It's okay. Somebody who's trained can help you with that.
Okay.
Thank
Well,
you very much.
Yeah, with that, I think we will conclude. I thank you, Anne-Marie, for very much for doing this seminar. And you're a real professional. You went beyond your duty because we were supposed to end up at 2:30, and now it's well behind past the 2:30. So thank you very much again, and thank you, everyone. Until next time, see you. Bye-bye.